I'm Usama Ali, a master's student in public health promotion. In this short documentary, we group of 4 individuals explored why diabetes is increasing, how social and environmental factors shape people's risk, and how health promotion approaches can support prevention and better self-management. Diabetes is a chronic disease that occurs either when the pancreas doesn't produce enough insulin or the body cannot effectively use the insulin it produces as mentioned in the WHO. Type 2 diabetes is one of the fastest growing health problems globally, as more than 95% of the diabetic people have type 2. Thousands of people live with this condition, often diagnosed late, which affect on their living, working, and taking care of their families. That place a huge pressure on the health services. Blood glucose is the main source of energy and comes mainly from the food we eat. Insulin, a hormone made by the pancreas, helps glucose get into our cells to be used for energy. Now, in type 2 diabetes, body becomes resistant to insulin or doesn't produce enough insulin, which can lead to high levels of blood sugar. Over the time, type 2 diabetes can cause serious damage to the body, especially nerves and blood vessels. If it is not well controlled, it can lead to serious complications such as heart problems, kidney damage, eye problems, and even amputations. Type 2 diabetes can often be delayed or prevented through effective health promotion and support for lifestyle change.
Well, how big is the problem? According to World Health Organization, type 2 diabetes prevalence has nearly doubled since 1990, reaching a rate of about 14% in adults aged 18 and older in 2022 globally. International Diabetes Federation estimates that 11.1% of adults aged in between 20 to 79 currently live with any type of diabetes, with over 90% of cases being type 2 diabetes. That projects the rate will continue to rise to 1 in 8 adults by 2050. In UK, 3.6 million people are at risk of developing type 2 diabetes. In Staffordshire, prevalence rate is higher than the national average, that is also rising. Over 90% of diabetes cases in Staffordshire are of type 2, particularly affecting older individuals, male, and those in most deprived area, as stated by Staffordshire County Council. The burden is not equal. People living in deprived area and minority ethnic communities are at higher risk and face more barrier to diagnostic or treatment. This makes diabetes not just a medical issue but also a major public health and health equity challenge. Well, type 2 diabetes health promotion emphasizes the social determinants of health, the condition in which people are born, grow, live, work, and their ages. For type 2 diabetes, these determinants include the local food environment, opportunities for physical activity, income and education, housing and cultural or gender norms around eating and exercise. When unhealthy food is cheap and available everywhere, or when work and caring responsibility leave no time for self-care, it becomes much harder to just eat better and exercise more.
In this documentary, we focus on a local diabetes prevention and self-management program in UK for adults at high risk or recently diagnosed. The program offers group education sessions, individual counseling, and follow-up support. People learn about healthy eating, physical activity, and taking medication correctly, also monitoring their blood sugar. From a health promotion perspective, this program aims to empower people to understand their condition and to make realistic changes in their lives. This program is linked to the COM-B model of behavior change, which suggests that people need capability, opportunity, and motivation to change their behavior. Education and skills training build capability, supportive families, groups, and environments create opportunity, and goal setting and feedback strengthen motivation. The program also reflects principles from the Ottawa Charter for Health Promotion, especially developing personal skills through education and creating supportive environments by working with families and local food outlets.
So, William, the first question for you is, when did you first learn you had diabetes?
Well, I found out after feeling very tired and thirsty. My doctor ran some tests and told me I had a high blood sugar.
So, the next question is, what information did healthcare professionals give you? Was it easy to understand?
Well, they explained diet changes, exercise, and medication. Some things were clear, but a lot of the medical words were confusing at first.
Okay, so what makes it difficult to follow the advice?
It's hard to change habits. Healthy food can be expensive, and sometimes I don't have time to cook or exercise.
Okay, so what support has been most helpful to you from the friends or any sort of person?
My family reminded me about my medicines and helped me with meals. My nurse also explained things in simple language, which really helps.
Thank you, William. Wish you a good health. Have a nice day. Like many people, William first realized something was wrong when he experienced symptoms like thirst, weight loss. After diagnosis, he received advice about diet, physical activity, and medication, but understanding and applying the information in daily life was not straightforward. Their story highlights the importance of health literacy, people's ability to access, understand, appraise, and use health information. When educational materials are written in complex languages, when consultations are rushed, or when advice doesn't fit people's economic or cultural realities, health literacy is undermined and behavior change becomes much harder.
Well, it's a common in the community due to high rates of obesity, limited access to the healthy food, and low physical activity amongst the people. Many people are diagnosed late, which is leading to preventable complications. So it's a major public health concern for them. Yeah, we focus on the lifestyle education, nutrition support, exercise guidance, behavior change, counseling, and regular clinical monitoring. We also tailor material to culture and language needs and offer group or preferred support sessions to the people. Well, the most of them, which I would like to elaborate over here, is the motivational interviewing, setting small, achievable goals to the people, self-monitoring, positive reinforcement, and helping patients to overcome the barriers. Because once you motivated a person, he changes his minds, and from there the whole cycle starts revolving. It can be change. For example, you're giving someone to do a small steps, like suppose I'm telling you someone that okay, you have a goal of to do a 500 steps in a day. So someone who achieve the 500, it will increase this to 1,000 and then go on. Well, we track clinical outcomes, as I mentioned, HbA1c, weight, blood pressures, attendance, lifestyle changes, and patient feedback. Long-term trends in new disease cases and implications also show the impact on the people.
Thank you, ma'am.
Thank you so much. Take it. Bye.
Well, to judge whether the program like this are effective, we need a clear theory of change and an evaluation plan. Inputs such as staff funding and education material lead to activity like a group session and one-on-one support. In short term, we hope to see an increased knowledge, improved confidence, and small behavior changes. In the longer term, we look for sustained changes in diet and physical activity, weight loss, better blood sugar control, and improved quality of life.
Strengths include a clear focus on high-risk adults, the use of theory-based strategies, and attempts to empower people through education and peer support. There is a risk that those with more time, money, and existing health literacy benefit most, which could unintentionally widen inequalities.
Type 2 diabetes is not only a clinical diagnosis, it is a reflection of how our societies are organized. Effective health promotion must combine evidence, theory, and real-life experience. Thank you for watching.